It's a good AGam in Kansas morning. Good morning. Let's take a look and see what's coming up today. First, Tom Cohen, co-founder and CEO at Nanopore Diagnostics, discusses his company and how it applies to agriculture. Next, we hear from Steve Berger with Aptimmune Biologics, a company that has developed mucosal vaccines for swine. And then Tomas Pena, co-founder of S4, tells us how they turn technical data into actionable information for producers. We'll end with the new CT table at K-State and how it detects lameness in equines. Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hi, my name is Tom Cohen. I'm the co-founder and CEO at Nanopore Diagnostics. We're developing a rapid on-site platform for screening for microbial pathogens in a wide array of sample types. This could be, for instance, in looking at crop pathogen detection, trying to detect disease before symptoms show, possibly looking for diagnostics in the livestock space, or maybe post-slaughter in a slaughterhouse, or maybe in an aquaculture pond. The test will be an instrument that has different consumables focused on these different verticals that we plan to attack. It's a nucleic acid-based counter. So the way the test would work is it would take a sample, it would lyse all the cells present, and in the kind of soup that remains, it binds a probe to a particular nucleic acid indicative of a species and pulls it through a sensor that then counts that probe-bound target. So it utilizes genetic sequences indicative of nasty bacteria that might be present and counts them. The way we're able to potentially attack multiple verticals within the ag tech space would be by having different consumables that would focus on the pathogens relevant to a certain application. For instance, in the food safety application, we might focus on different E. coli variants, but in crop pathogen detection, we might look at crop greening disease or different viral vectors that are important in that space. We hope we're about 2 years out from launching the product. We think, maybe about 9 months to a year away from doing some on-site actual testing. Our history primarily is in clinical science. This is actually an academic invention that we pulled out of the university, and in the academic world, and then also for the first 9 months of our existence, we kind of focused on the human clinical applications of our platform. And so we now have developed a lab prototype and validated that with some clinical samples. But before moving forward into turning our prototype into a product, we decided it makes sense to pivot to a space that has a lower barrier to entry. We know we face significant barriers in the clinical space due to the reimbursement and FDA regulatory process. And so by moving to some markets with lower barriers to entry, we have lower perceived risk and become a more fundable opportunity. I think another key point is the reason I'm here today then is just to get to know the ag tech sector and try to identify opportunities for our platform. My background is exclusively in biomedical science, and so as we look to potentially pivot to the space, events like this are key just to meet the people that might one day use the product and identify their needs.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life, and a few years ago I had an injury that created what they call a frozen shoulder in layman's terms. It got to the point that I couldn't reach, I couldn't sleep, I couldn't do anything. After speaking with the surgeon in Tulsa, he finally told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. I decided that, maybe I better listen to my friend John, and I called Kansas Regenerative Medical Center. I talked to Patrick Farley and was just excited about the whole aspect of going up there and having the opportunity to focus on getting better. The next morning at 8:30, went into the clinic, did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. I feel better. We work around here. Some days we work pretty hard around here, and like any older guy does, I get pretty sore, pretty tired, but my right shoulder doesn't get sore. It's like a baby's arm.
Soil is the life of a farm, and for 25 years, SureCrop liquid crop nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Kansas Wheat. Learn more at rediscoverwheat.org.
Hi, I'm Steve Berger from Aptimmune Biologics in Champaign, Illinois, and I am the development director for the preparation of our vaccine formulation. So Aptimmune is developing mucosal vaccines for swine, particularly against two diseases, PRRS virus, which is a deadly and very costly disease for swine practitioners, as well as influenza, swine influenza virus. So Aptimmune is preparing to commercialize our vaccine in the industry, and we're preparing for a Series B round of financing. And so we are visiting with prospective investors and also technology partners that may be interested in supporting us in this endeavor. We are only dealing with pigs and swine diseases at this time, although the technology platform may lend itself to other species such as cattle. The Aptimmune mission is focused on swine. Well, this is a novel formulation of vaccines. Typically, vaccines are administered to production animals intramuscularly or subcutaneously. Our vaccine formulation is actually administered intranasally, which we believe is responsible for stimulating a robust immune response in the mucosal surfaces where these diseases have the biggest impact. And so the immune response that's elicited against the mucosal surfaces then helps those animals to survive a real life challenge of these difficult diseases. And the technology that Aptimmune has licensed has come out of both the University of Illinois as well as Ohio State. This formulation has been demonstrated to be superior over traditional vaccine approaches. And we most recently have completed a study and also have confirmed that.
KFRM is one of the largest farm radio stations in the nation, dedicated to informing and entertaining rural listeners from northern Oklahoma to southwestern Nebraska. You can catch KFRM in many ways. Of course, 550 on the AM dial, streaming at kfrm.com, or on your smartphone by going to the TuneIn Radio app, or on AGam in Kansas on Tuesdays and Facebook every day of the week. KFRM, tune us in. You'll be glad you did.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
The Kansas Wheat Innovation Center in Manhattan is rediscovering ways to get improved varieties and new genetics in the hands of farmers faster. Grower-led and checkoff-funded research initiatives are bringing about positive change. This grassroots leadership provides a strong voice in Topeka and Washington, D.C. Now is the time to partner with Kansas Wheat in moving wheat forward. Kansas Wheat Commission and Kansas Association of Wheat Growers. Farmers investing in their future and yours. Log on to rediscoverwheat.org.
This segment brought to you by SureCrop, liquid crop nutrition delivered right to your farm.
Hello, my name is Tomas Pena. I'm U.S. country manager and co-founder of S4, and we're here at the Ban Trump conference in Kansas City because we were invited by the iSelect group from St. Louis because we represent one of the startups in the St. Louis community. We won the Arch Grant Awards last year, and we are part of the Yield Lab and 630 acceleration programs. We are very happy to be here in the Missouri area, and we are from Argentina. We came last year in May 2015 as part of the first batch of the Yield Lab, which were selected as out of 115 companies all over the world. They selected 5 companies, S4 was one of them, and we moved and opened the St. Louis office based at the Helix Center. So the solution that S4 brings to the table is with the S4 index, we are able to monitor and follow up what's going on in the farms, especially in corn and soybean, and we're focused in Argentina, Brazil, and the US. We bring to the table solutions for risk management, basically drought insurance through index-based coverage. We are doing that with ag suppliers in Argentina, and we'll probably launch Brazil next year. We're working on that. We are also in the US, we're working with portfolio monitoring for insurance companies, and we are working on parametric coverage for the US companies that sell to farmers. So our focus is not the farmer itself, but whoever supplies any kind of goods to them. The technology that we use is based on MODIS sensor in NASA satellites, and that brings a pixel of 15 acres. So it doesn't allow us to go into precision agriculture, but more into decision agriculture, and monitor how well the farms are performing and benchmark themselves against their history and the evolution of the county.
Grain sorghum is one of the most important cereal crops worldwide, and Kansas leads the nation in its production. Over the years, sorghum has been either exported, used in animal feed domestically, or for other industrial uses. Recently, its use in the ethanol market has seen tremendous growth, with 30% of domestic sorghum typically going to ethanol production. Kansas Grain Sorghum is committed to sorghum research, market development, and education. Learn more at ksgrainsorghum.org.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
Tallgrass Commodities offers producers bulk commodities at a reasonable price with reliable service throughout the whole Midwest. To find out more about Tallgrass Commodities, visit tallgrass.us or call 785-494-8484.
This segment brought to you by Kansas Corn. Learn more at kscorn.com.
I'm Gary Fike with the Red Angus Association of America. I'm the Director of Commercial Marketing. And we recently decided to conduct a survey with the aid of Kansas State University veterinarians Dr. Dan Thompson and Dr. A.J. Tarpoff to determine what the most widely recommended practices were in the commercial cow-calf industry. So with a great deal of help from them, we surveyed over 1,100 veterinarians across the United States. A big survey because represented 35 states and 3 Canadian provinces, but maybe what was most impressive about it to me was 2/3 of those responding veterinarians came from one of the top 10 beef cow producing states in the US. So that was a big part of it, plus the fact over 30% of those veterinarians had 30 years worth of experience, but we had a pretty good mix because another 26% had 0 to 5 years of experience. So that was a nice cross-section, we felt, of the industry. We did this because, you know, there's a lot of different health protocols out there, and we just really wanted to get down to what it was that was being recommended by those veterinarians out in the commercial world, in addition to the fact that during this time of perhaps thinner profit margins, we need to make sure that a good health protocol is being followed, because cow-calf producers might look at ways they can cut costs, and doing that by not giving the correct vaccine protocol may hurt them in the long run. So we just want to make sure that everybody kind of understands from this survey what is most important and what really needs to be done. The overwhelming majority of veterinarians that were surveyed said that you need to use a modified live vaccine, whether it's at branding, whether it's at pre-weaning, or even post-weaning. If you look at branding time, and we call branding time at 2 to 3 months of age. So in a spring calving herd, you know that's going to be May, June maybe. Those calves should be given a modified live vaccine for the vaccines recommended, predominantly the clostridial diseases, bovine respiratory syncytial virus, BRSV, and PI3. BVD types 1 and 2, not so much, 78 and 77% at that time. But only 10% of the, or 12% of the veterinarians recommended that you use a killed vaccine at that time. When we move to pre-weaning and post-weaning, it still doesn't creep up a lot, but it still goes to 90 or 91% of those veterinarians recommending you use modified live vaccines versus killed. And then the use of the BVD and then the types 1 and 2 BVD jumps from 77-78% at branding time to 96 and 97% at post-weaning time. Those are very important vaccines that need to be given at that time, because the calves are going to be shipped, obviously, maybe right off the cow, or they might be weaned for 90 or 30, 60, or 90 days afterwards before they're shipped. So the results of the study are actually going to be released at the Red Angus Brain Trust, which will be January 7th out at Denver during the stock show, during the National Western Stock Show. After that, the study will be available on our website, and it's also being submitted for publication in a refereed journal article, and that should come out probably sometime in the middle of the year. That's a scientific journal that probably is not going to be widespread in the ag media, but we'll have stories out ahead of that time that will be in the general ag press. What we really hope for this study and the results of this study being broadcast to the industry, if you will, is that producers see the Red Angus Association as being concerned and proactive about the betterment of health protocols in the entire industry, and not just about Red Angus cattle, but getting the information out there so that people make the right decisions no matter what kind of cattle that you raise.
The new Better Horses Network is worldwide, presented by Lucas Oil, featuring worldwide radio and TV with iconic hosts like Al Dunning, Sharon Camarillo, Ernie Rodina, Lindy Birch, and Craig Cameron. With American Cowboy, Horse and Rider, Brushy Creek, Cavenders, and Ride TV. Worldwide radio and TV, the all-new Better Horses Network.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hello and welcome to Horsing Around. I'm Dr. Chris Blevins at Kansas State University Veterinary Health Center, today with Dr. Beth Davis. Welcome.
Thank you.
Dr. Davis is a professor and a section head here in equine at Kansas State University Veterinary Health Center. And today we're going to talk about something fairly exciting for here in the equine section, and that's a CT table for horses. What is a CT table for horses? Because some people will be like, well, you know, it looks kind of neat. They might recognize it in their own hospital. But.
Right, yeah, that's a great question. And so we think about CT and advanced imaging capabilities, and most of the instruments that are available are designed for people, understandably. So it's easy to adapt those instruments for use in small animal patients. But when we work with our equine patients, unfortunately, we can be a little bit limited. And so we're very fortunate that there is an equine CT table available. So we recently acquired ours, and so it's right behind us, and it is adapted to the small animal table, but it fits over it, and it allows us to get the same kind of images that we could get if we were looking at a person or a small animal patient.
This is a big thing, and some people may not know about that aspect until you actually have potentially a horse that maybe would need to be used for it. And what kind of things could a horse get imaged for on this CT table?
Yeah, that's a good point as well. And so we think about it for things that we might start with radiographs, or conventionally we may have taken x-rays, but it allows us to get really nice images of the head, of dental structures, horses that have sinus disease, but we can also look at limbs, so at extremities. So we can look at the lower limb, we can get on the front leg up to the carpus, or the knee, as some horse owners call it, or up to the hock on the back leg. So really good for distal extremities as well.
And the amount of detail that they get from this is just phenomenal. I think from an imaging, diagnostic, and potentially doing other treatments using CT. What would be, I guess, some images that they could get or extrapolate from using this type of table?
Yeah, so the imaging, the quality is incredible. This is a 16 slice CT, so we can get really finite detail on the structures. The other capability is that we can do what's called 3D reconstruction. So we can take what would normally look like a 2D image and actually put all of the images that have been collected together to get 3D imaging, so essentially to make a model of the patient that we're looking at. And what that allows us to do is then to go in and perform different procedures or therapies, maybe an injection, maybe a repair of a fracture. And this ability to image with this machine allows us to do that at a much higher level.
Higher quality medicine, better thing for the patient themselves and for that client. This table wasn't inexpensive by no means, and I guess some people don't realize the aspects of, well, we just bought it. Well, what did the vet school or veterinary health center have to do to get this table?
Right, it was a team effort for sure. So we are very fortunate to have support from the hospital, from the College of Veterinary Medicine, but also from horse owners and horse enthusiasts in the state of Kansas. And so we had a group of people approximately 2 years ago that helped us put together a fundraiser. And that fundraising event, we are so appreciative of all the people that helped us with that, because that's in large part what allowed us to get this equine CT table. It was a huge effort and a huge success.
Well, we sure appreciate all the support from everybody around, that is for sure. And so owners might say, hey, I think my horse may need to use this table, or maybe it would, maybe it wouldn't, and come through a referral or even come in here at the hospital. How would that all entail as far as if a horse needed to use a CT table?
Right, exactly. So we want to start at square one. So starting usually with either your veterinarian at home or coming to the vet school and having your horse evaluated, determining what sort of testing needs to be performed, and then decide whether or not a CT is appropriate. But absolutely, we welcome the opportunity to work with veterinarians and horse owners throughout the state to provide them with advanced imaging that we now have.
That is great. Well, if they ever want to know more information about the CT table, or Dr. Davis or myself, or anything here at the Veterinary Health Center, you can sure go to our website at www.vets.k-state.edu and go to the Veterinary Health Center, and they can learn more information about all this information and great diagnostics we have here at the vet school. I'm Dr. Chris Blevins with Horsing Around, and we'll see you around.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. Watch AGam in Kansas online at agaminkansas.com.